Good day. Welcome everyone to Solve.Care panel discussion on healthcare in the post-COVID era and the role that blockchain can play. I am your host, Jefferson Nunn, and will be moderating a fantastic panel discussion about how healthcare in the post-COVID era is going. Joining us today is Dr. Ashraf Affan, Chairman of Angel Kids Pediatric. Dr. Ashraf, can you introduce yourself?
Hello. Yes. Hi, my name is Ashraf Affan. I'm the chairman of Angel Kids Pediatrics. We are a pediatric group in Northeast Florida. We run around 7 offices and caring for almost 45,000 families in Jacksonville area.
Thank you. Also joining us is Dr. Swapna Vaidya for Kaiser Permanente. Dr. Swapna, can you introduce yourself?
Hi, yes, I'm Dr. Vaidya. I'm a psychiatrist, and I have worked extensively in academia as well as community health clinics. And right now, I am a psychiatrist at Kaiser Permanente. I'm also the psychiatrist for an advisory board for Jenny, which is a women's-based company for menopause. And I'm interested in sharing my thoughts about healthcare post-COVID. Thank you.
Thank you very much. Also joining us is Michael Kessel, President and Chief Executive Officer of Cleveland Clinic, Canada. Welcome, Mike.
Thanks, Jefferson. Nice to see you and all the panelists here. My name is Mike Kessel. I'm the President and CEO of Cleveland Clinic Canada. Cleveland Clinic, we are part of a large nonprofit teaching hospital that's in 15 countries and 160 cities around the world.
Thank you, Mike. Last but not least, we have Pradeep Goel, Chief Executive Officer of Solve.Care. Hello, Pradeep.
Hello, Jefferson. Hello, all the panelists. It's great to be here. My name is Pradeep Goel. I'm the CEO of Solve.Care. And I'm looking forward to having this conversation about the application of blockchain in healthcare, particularly in the post-COVID world.
Awesome. Thanks, Pradeep. And again, I'm your host, Jefferson Nunn. I'm the Chief Editor of Liquid Health News and the Director of Biotoxin Foundation. And I'll be moderating this discussion. And the first question that we have today relates to how has your practice been impacted by COVID? For example, what has been the good and also the not so good changes that have happened within your practice? And so leading off our discussion would be Dr. Ashraf Affan. Go ahead.
Thank you very much. And as I mentioned, we run a pediatric practice in Jacksonville, Florida. So when the pandemic hit, around the mid of March, all of a sudden we woke up in the morning and we saw how basically the life was changing. Our patients were panicking, our staff, our providers. So it was really a huge thing that, the intake, not only for our practice or our area, as everybody knows, it was a global impaction for this pandemic. So immediately what we did in our practice is we put a strategy with some goals for our strategies to stay safe for our staff and for our providers and for our patients as well, answering their questions and be in communication with our patients. So this was a positive thing. We had a good leadership in our practice here. We created a force task to tackle this problem immediately, and we were able to navigate through the system, and I'll get a chance to speak about this. So.
Awesome. Dr. Swapna, what about your practice in the mental health world? How does that change?
Well, as you know, as Dr. Affan said, that COVID changed everything and very rapidly. More so in the mental health area, there were two things that happened. Number one, we had to rapidly pivot and consider an alternative model of delivering mental health. And that was sort of new for patients as well as for the doctors. Second thing was to then channelize this and to get, the administration to kind of buy in with all of that. So it was a rapid navigation and a rapid pivot, as we said. What I found interesting was that the patients actually embraced this modality. And in spite of feeling that this is probably not going to be how mental health will be delivered, I think that this has actually created now an open door as to how the new normal will be. So that is my experience here. And I joined Kaiser Permanente for precisely that reason, because this organization had already pivoted and already established these telehealth models across. And so they were able to better embrace and navigate around this situation that happened. But I feel that with blockchain technology such as Solve.Care, I think that we are going to be able to even finely nuance it and make it in such a way that it's a safe way to deliver care. Thank you.
Thank you very much. We also have Mike with Cleveland, Canada. I mean, I can imagine COVID has had a big impact, both bad as well, on your practice. Can you tell me about how that has changed your practice?
Yeah, it's really two big areas. I mean, the first, not a surprise, it kind of forced a lot of patients to go virtual, right? And so within our system, we do approximately 1 million medical consultations a month. And about 30% or so of those automatically became virtual, right? And then it has titrated up and down. So ensuring that we were properly supporting our clinicians, our physicians, nurses, et cetera, and our patients was a really high priority for our team. And I think we've pivoted. I think the team has pivoted globally very well and been agile. I think that was a big thing. And the second thing is, Dr. Vaidya just mentioned it around mental health. So huge ramp up, and especially here in Canada, with regards to mental health and making sure that we have our psychologists, our psychiatrists, our social workers, our psychotherapists, we have capacity, right, to handle this, because we had actually done a survey, the clinic in June, and we'd actually surveyed about 1,000 men over the age of 18. And two interesting facts came out of that survey that probably aren't a shocker for everyone on this call. 77% of men said that their stress level had increased during COVID. But the second piece, which was interesting, is 59% of them said it was a greater impact on their mental health than the 2008 recession. So just to put that in perspective, I thought that was a really interesting survey and some data that came out. So those are the two big areas.
Thank you, Mike. Also joining us today is Dr. David Hanekom, the Chief Medical Officer and President of Solve.Care. David, if you could introduce yourself and let us know your thoughts about how Solve.Care can help this post-COVID world.
Certainly. Thank you, Jefferson. I'm David Hanekom. I'm a general internist, family physician, and the Chief Medical Officer of Solve.Care. My passion really is around making healthcare working better for all by making sure that the best interest of the patient is always held at the center of everything we do. So we focus on the areas of clinical improvement, evidence-based medicine, making sure that administration and payments are more seamless. And so in terms of COVID, it has had a significant impact on healthcare delivery globally. I would liken the changes that are occurring in healthcare delivery and the manner in which we deliver healthcare very similar to the radical changes that were forced upon us with the 9/11 attacks in the United States, where the airline industry and international travel changed significantly. What you're hearing and what we're hearing is that digital access and online service delivery is now a critical component of the in-person healthcare delivery. And I think blockchain has the ability to enable a more efficient and a more personalized delivery of healthcare in a crisis time, where if you look at the number of individuals that have passed away from COVID being in excess of 1 million people thus far, and about 44 million people being infected with COVID, you can just imagine the impact that that has had on communities, the population, families, and whole countries. And so I expect, as Michael and others have said, that the need for behavioral health services and emotional support can really be facilitated through the application of blockchain.
Fantastic. So along with this, there was a couple of interesting factoids that came out about how stress is really seeming to get all of us, especially after the 2008 crisis, which was pretty bad, and this is apparently works. So Swapna, could you tell us more about how we could maybe de-stress ourselves, and maybe how blockchain can help us get past
With
this?
that. Okay, well, that's a long conversation about how to de-stress. I mean, I do have seminars and happy to share my thoughts. But I think that what this has actually showed us is, first of all, there was always this subliminal access to mental health care that was problematic. And this pandemic has now unearthed it. And you can actually see that there is a struggle. Now, across the United States, there is a shortage of psychiatrists, as we all know, especially in the rural areas. Now, imagine with COVID, that has even multiplied and intensified. And you talk about isolation, you talk about not going out and meeting your friends, your family. So that has compounded it. Now, I do feel that this has actually led to explosion of telehealth across, especially in psychiatry. I mean, as you can see, and I have been reviewing, there are multiple companies, multiple private practices that have come up. And I have reviewed some of them, even worked for some of them. Now, what I found is that why would I go for a blockchain kind of a platform? Because there is the accuracy and there is protection of data to such a point that there will probably be less ability to access or hack it. I mean, we all talked about the Zoom calls, the Zoom meetings, and how that was hacked. So for me, particularly, when I look at psychiatry and I look at what I want to give my patients, is a clarity that they have privacy and that they are not going to be scared about utilizing this internet modality and thinking that their information is being shared. So that's a huge point. Plus, you can have accesses with resources such as reaching out to psychologists, psychiatrists all over the world, for that matter. You can match patients with the language that they speak. I mean, I personally speak Hindi, Marathi. I would like to help out some of my friends and some of my family back home in India. So I think such a platform actually kind of breaks these barriers and allows the access between patients and psychiatrists and psychologists and social workers and what have you. And this is why I feel that I'm very interested and very invested in this being the new normal.
Thank you. Fascinating. So what about nursing homes and personal care in nursing homes? I mean, I imagine there's a lot of medical records that might be scattered and whatnot. Dr. Ashraf, could you talk a little bit about how that has changed your practice? With kids, trying to help them out as well. How can we make sure that medical records follow us from the beginning all the way to the end using Solve.Care?
Yeah, I think this is really very important point, especially applicable to my practice in pediatrics. We take care of kids from newborns all the way to adolescents. Just want to echo on what Dr. Vaidya said about the mental health. So in our practice, we saw the new normal for kids not being accepting this new normal. Imagine those kids are not going to school. They have to be confined at home and not meeting with their friends. The new normal for them is not to be able to group, to play, to go out. Kids are born and created to do all those activities, and now it's really tough for them. Added to this is what happened with their parents. The parents were very very unclear and very uncertain about doing virtual health, not like in adult population where it's easy to do this virtual and telehealth. In pediatrics, the parents were really very worried about their data for their kids, the security, the madness going around the internet right now, and they don't want to expose the information about their kids on the cyberspace, if I would say that. So the blockchain was really a good solution for the security. No hackers can get into this information. So I think that is really very important that in the future, if somebody decided to give up the practice, now we see a lot of practices, doctors who are almost in a retirement age, they said, like, because of the COVID, because of the pandemic, we are not practicing anymore, so we're going to close our practices. Imagine if those information for all the patients that they have been caring for is not or you could not access this anymore. So I think the solution with the blockchain is the answer for this in the future. I just wanted to elaborate a little bit on Solve.Care being a pioneer into this area. I had the leverage myself in my practice to use the Care Wallet done by Solve.Care that helped us to navigate through this COVID time. We have some of our employees working from home, some of our patients that have some issues to report to us. They were very easy to go to the app for Solve.Care and get the information, detecting how they are doing. If anybody has an exposure, we would be able to know about it before it becomes an issue. So we were able to isolate, we were able to get patients to quarantine, or some of our employees as well.
Fantastic. So one of the things that we just mentioned was security, and blockchain is trustless. But Mike, could you talk a little bit about how we can encourage adoption in a trustless kind of a system like this?
Yeah, I think it's the right question. And I think it's really important for leadership of healthcare systems, obviously, investigate blockchain and investigate Solve, and to basically do their own diligence, if you will, on leveraging this technology globally. I think supply chain in healthcare is most likely a pretty good place to start. One of the reasons I think it's a good place to start is oftentimes in supply chain, there isn't personal data and information attached for moving information to different regions, to different cities, et cetera. We're in, as I mentioned in the beginning, 15 countries and 160 cities around the world. So solutions like this are really important. And it's also, I think it's a good starting point to leverage a technology like this. I think, and then secondarily, I think in terms of use cases within supply chain, once you gain your comfort with the trusted network and the trusted system and the transparency of it, and there is any patient information, if you will, included, I think the ability for the ledger, if you will, to track things like medications and to audit that and to ensure that it's getting delivered to the right patient at the right time and with the right dosage, et cetera, is really obviously important. It could be another use case, if you will, of leveraging this.
Interesting. Well, along with that, I'm wondering about in the COVID world. I mean, you have many different kinds of vaccines coming up, 3, 4, 5 different types, and unknown efficacies about that. How could we potentially better track how that's doing? Pradeep, could you weigh in on that? Pradeep, we can't hear you.
Sorry. Thank you, Jefferson. As Mike just mentioned, blockchain as a ledger has very powerful applications in healthcare, particularly in the current world, where we need to give the patient much more control over their information and much more ready access, but to do so in a manner that protects the privacy of the patient. And Dr. Affan mentioned just recently the scenario where parents don't want to put their kids' data online. I would 100% subscribe to that. I have 2 young kids, and putting up any of their information in a manner that I cannot control is very, very concerning. So end of the day, having a blockchain-based system like Solve.Care is building, where we can create controlled care networks, which are essentially ledgers that are shared by a well-defined population. And each population, each participant of the ledger can see what they need to see, publish what they need to publish, and control who else can see that information, and make that all auditable. Creates a balance between security and privacy, as well as a need to coordinate. Because healthcare is a team sport. You always need to coordinate information between doctor, patient, nurse, pharmacy, specialist, therapist, and so on. And then you also need to maintain that only the right people with the right reason have access for the right amount of time to that information. And centralized systems that exist today gallantly try to do that job is much more difficult. And in this world where people aren't all centered around a single delivery system or aren't in a single location and aren't really tied to the same core systems, makes it very hard. So in a nutshell, in the current world where healthcare is becoming decentralized by necessity, where patients and doctors and nurses and therapists and pharmacies by definition have to be remote and have to learn to collaborate with each other, using a shared ledger technology that is secure, that's private, that is controlled, that is auditable, becomes a very powerful thing. Now, in the context of vaccination that you just mentioned, we see this as to be a tremendous challenge and a tremendous opportunity and a use case for blockchain, particularly for a platform like Solve.Care. Because when you look at the upcoming challenge of distributing vaccines to the whole population around the planet, managing and maintaining accurate records, ensuring that people can maintain their privacy, at the same time can report whether they have or have not been vaccinated and whether they are experiencing any symptoms. There's going to be a lot of political and cultural considerations there around how we get the vaccine in the hands of people who need it and still maintain a very high level of patient privacy. So the idea of using a blockchain ledger to track the distribution, the consumption, the application, and the post-vaccination symptoms in a manner that patients feel comfortable and trust the underlying system, so that they can have a meaningful understanding of what is available to them, what is happening, and what needs to happen. These are all very basic problems that we're going to have to solve. And given the political risks involved with vaccinations that we're going to face, people are going to have a hard time trusting any system that's not in their control to the degree where they don't control their own data. So the notion of a distributed ledger that truly gives you and I individualized control and access to our information and allows us to understand that nobody else that we have not permitted is able to see this information, be it government or be it care provider. That balance is going to be critically important. So in a nutshell, what Solve.Care is doing is launching multiple care networks. These are essentially purpose-built ledgers that are used by a specific group of people, patients and doctors, who share a certain need for coordination. And those ledgers can be controlled by the participants so that all the information that they are putting on the ledger is only seen by those people who have a need to see. And that, I think, is going to be very important in the context of telemedicine, in the context of remote patient monitoring, in the context of vaccination, and really the general delivery of healthcare post-COVID.
Interesting. Well, that brings up a couple of thoughts. One thing was about how there's a lot of paperwork that seems to be floating around the system right now. I just read an interesting stat: 1.2 or 1.3% of the entire U.S. GDP is spent on paperwork in healthcare. So, Mike, I realize you're there in Canada, but still, there's a lot of paperwork around this. Could you talk more about how we can try to reduce this paperwork overload?
Yeah, I think that's well said. There is a lot of administration. There is a lot of paperwork, and oftentimes it's actually following. And some of our physicians could obviously talk to this point, following the patient as referrals are made throughout the network. So I actually think blockchain could you could leverage blockchain to help close the loop when our physicians are issuing referrals to patients. Oftentimes, as you probably know, in Canada, I'm sure it's occurring in the US as well, the famous fax machine is being used still. So my hunch is by using blockchain to follow referrals that are being issued by physicians will help reduce not only make it kind of a better patient experience and ensure we close the loop and increase care, increase quality, but with the triple win, if you will, it will also help reduce costs as well. And I think there's a nice opportunity there.
Interesting. Swapna, how about how the financing side of this plays out? I imagine, you want to make sure that, you can get paid, and if you don't submit paperwork, you don't get paid. But what if you forget to file the paperwork? What happens then?
See, that is, as we know that we live in a little bit of a flawed world, and healthcare system, especially in the US, all of us doctors who worked in the US, we have known about some of the constraints. And as you mentioned, this redundant paperwork, that is actually not beneficial so much to the patient or the doctor. Now with COVID, you've seen this trend, right, change actually in the sense that telehealth is becoming more and more available. But what it doesn't solve is the immediate payment. So for instance, if you are contracting with an insurance company, and let's say your patient is out of network, the patient will have to submit the bill, and then there will be the review, and then there'll be more paperwork that's asked. And at the end of it, the decision would be made as to how the doctor would get paid. Now, what I liked about Solve.Care and the platform was that there was a transparency between the patient and the physician, the price being set, and the money would actually be deposited in the doctor's account, after or before the session. So it is a way important for the doctors as well as for the patients, because there is transparency and there is not a third party or fourth party or fifth party looking at the paperwork, looking at whether these elements have been discussed or not. So I think it's bringing back, the relationship between patient and doctor as it should be, as transparent as it should be, and altruistic as it should be, without having these third-party members. If, I call it the utopia of medicine. That was something that I feel like if this is what medicine would be like, I think doctors, patients, everybody would actually experience it in the most authentic way and for what it was made to be, rather than just a business.
Interesting. So how about this idea of decentralized finance? The information is out there, so to speak, but we're trying to track, the efficacy of care and so forth. So within Angel Kids Pediatric, do you see a role that this decentralized finance can play, Dr. Ashraf?
Yes, actually, this is really a very important thing that my colleagues have just mentioned about the redundancy and kind of waste and the finance. I think, expert have already looked at this, and if everybody is agreeing with me that the entire healthcare system in the United States and to be followed by the other countries around the world is moving from what we call the volume to the value of the care. And that's exactly to tackle and to address everything that Pradeep and the others have mentioned. The high cost, the lack of transparency, so I think in my personal opinion, because in our practice, we have a couple of those contracts, we call them the value-based contracts or risk sharing. It all centered around the patient's care to be in the middle, as well as the transparency between all the components of this healthcare delivery, from a payer to a provider to the patient himself. So I think the blockchain is the right answer for this, where all the data, all the financial information could be transparently passed between the providers of the healthcare and the payers of the healthcare. I think this is a good answer. There is almost getting into $1 trillion. Used to be 750 billion. Now we are moving towards $1 trillion of waste annually because of this lack of interoperability, lack of transparency, redundancy. And I think, as Pradeep has alluded a couple of times, that the blockchain could be the answer for this.
Interesting. Well, there was a couple of interesting things about the data bit, and a lot of people have the new Apple Watches and stuff, right? And now that data is all out there. David, could you talk a little bit about patient monitoring and how Solve.Care or blockchain can help with that?
Yes, thank you, Jefferson. I think that's a very important development as a result of the pandemic in terms of our ability to not only manage but interact with patients, grant them access remotely, and also do monitoring. If you, for example, take the most common chronic condition in the United States, which is hypertension or high blood pressure, we are very familiar in the evidence-based medicine with the consequences of poorly controlled hypertension. In other words, poorly controlled hypertension can lead to secondary events such as strokes, heart attacks, kidney failure, and multiple other conditions. The current standard very often is that a patient is seen once or twice or maybe 3 or 4 times a year and have their spot blood pressure checked when they're in the office. And based on those data points, decisions are made to manage a condition which is chronic and has a significant risk for a patient. With remote monitoring, and especially if both the device and the information sharing is protected by blockchain and it's decentralized, kept on the patient device, there is absolutely no reason to set the standard of care as the patient is engaged. They are responsible for monitoring their blood pressure based on evidence-based standard more frequently. These data points with smart contracts and alerts can then be shared with stakeholders in the blockchain, which may be their physician or their ACO, etc. And we can start incorporating these remote monitoring patient engagement tools and get a much better clinical outcome. And that goes for diabetes and multiple other chronic conditions. So I think you can get a seismic shift in the quality of care being delivered for patients with chronic conditions, and not only improve their quality of life, but also reduce the cost of care associated with managing all the complications. And when you look at the environment of value-based care, where the purchasers of healthcare are now saying, rather than paying you for each piece of work you do, which is the traditional fee-for-service system, which is volume-driven, we're going to reward you for value, i.e. managing hypertension and keeping patients healthy, and that's where your income is going to come from. Will shift our care to a different paradigm where remote monitoring is really critical. And the last piece is data security is a real concern for everybody, not just for the individual patients, for the large organized health delivery systems. On a daily basis, we hear about hacks and data loss across the world and the impact that it's having on people and systems. And so blockchain has the ability to reduce the risk of unintentional hacking and exposure of personal health information through distributed ledger technology. So I think there's a significant role for remote monitoring in providing better care, better outcomes, driving patient satisfaction, and actually driving value-based revenue to the deliverers of healthcare services.
Fascinating. And there was an interesting point that you brought up in there about the finances, pay-for-services model, things like that. In the U.S., we have this extraordinary mess with how doctors get paid. I heard they take 90 days sometimes to get paid after the invoice is submitted. How could, Solve.Care or even blockchain change that? Pradeep, could you talk a little bit about how that changes things?
I think it's very, the problem is complex. The solution is elegantly simple. The idea of using a digital payment currency boils down to having a complete auditability of who paid whom. That's the fundamental premise of real-time payments and streamlining healthcare. No one denies the fact that healthcare payments are complex, and there are some reasons why they are complex, because there is multiple parties involved between assessing the cost or the right price, and then different parties subsidize the cost, ultimately patient, family, employer, insurer, government. So because this requires coordination between multiple parties, it's obviously more complex than just writing a check from party A to party B. But if you want to bring it down to that level, allowing a delegated payment model in blockchain is conceivably much simpler than any other mechanism on the planet. So if you think about it, the simplest way to get payments made in the end would be for the service provider to get paid at the point of delivering the service, and the service receiver to make the payment using a mechanism that may be funded by their own money or by third-party money. So kind of like the ability to write a check, even though the bank account may belong to multiple people. So using blockchain as a payment methodology, you can get to that point where a patient can make a real-time payment to the doctor, but the redemption of that payment can come from multiple sources, be the patient's bank account, the employer, the insurer, the government agency, or all of the above, or some combination of the above. And that becomes only possible if you have a transparent ledger that can be safely and securely shared between the parties, such as who went to see whom, what was the treatment plan, what was the cost of the service, how much was billed, how much was paid, and how much is owed. So this whole notion of simplifying healthcare payments boils down to we need to be able to allow the patient to pay the doctor using third-party delegated funds, and to be able to audit them and to certify that everything happened according to clear benefit and payment guidelines. This is a complex problem that has been struggled with by, insurance companies, places where I worked at, Dr. Hanekom worked at, companies, organizations like Mike and Dr. Swapna and Dr. Affan, who bill insurance companies where I used to be at. We have this very tangled relationship of trying to take care of the patient while trying to protect or comply with various care and benefit and payment protocols. What blockchain does, and what Solve.Care has been doing, is allowing that complex relationship to get streamlined on the blockchain, because it's a distributed ledger, which is always immutable, which is always auditable. The need for paperwork goes down. You can permit real-time payments without having to stand in the way of being seen as standing in the way of a transaction between doctor and patient. And you can finance these payments, be either pre-finance them or post-payment finance them in a manner that the entire bureaucratic process that frustrates everyone and pleases no one, it can be streamlined. So I think there is a tremendous value. In the context of telemedicine, it's very simple, right? You need to allow a patient to interact with the doctor online and the doctor to get paid at the end of the session, and for that to be an inherent part of telemedicine. So my view here and my organizational view here is that telemedicine will take off both from a impact and in terms of acceptability from a physician perspective, if they can be assured of timely and preferably real-time payment at the point of care, rather than post-care 90-day wait period, as Dr. Swapna was talking about. Those are the type of use cases we are implementing today in Solve.Care. I'm sure not the only ones, but in terms of delegated payment authority to the patient, in terms of real-time payments to the physician, and in terms of ability to pay at the point of care, be it in person or on telemedicine sessions, those will inevitably converge in the post-COVID world. We won't be able to say, well, the payment model for in-person visit is this, and the payment model for teleconsultation is this, and they are completely different. And Dr. Affan, you run 2 different billing and payment cycles with us, because we will pay you differently than how we pay you in person, and we pay you differently than how our patient comes to you on telehealth. That streamlining is already happening in the context that US government is looking at scenarios where in-person payments and tele payments are going to be essentially the same, if not exactly the same. I think we're going to see that flow worldwide, because end of the day, I want for my kid the best pediatrician available to me right now. And if I need to make a payment right now, Either I'm going to pay out of pocket, or I'm going to want my insurance company to give me the authority to pay the physician I want to see. And that actually improves care. It reduces cost. Contrary to the previous viewpoint that utilization management is a way to reduce cost, the real way to reduce cost is to get the patient and the doctor to talk to each other effectively and in a manner that is aligned with the best care models. So payments have to become enablers of effective healthcare as opposed to payments being a barrier to effective healthcare. And that's where I think the blockchain as a cryptographic mechanism for making payments is so powerful and so important and so timely. And in the post-COVID world, we're going to see enormous migration away from paper-based payment and highly complex adjudicated payment model to a delegated payment system.
Interesting. Well, we have some questions from the audience, but thank you, Pradeep. Question from the audience, Dr. Affan. I'd like to ask you about how does the paper system work there? I mean, if you have medical records on paper and you have electronic medical records and records all over the place, how do you bring all this together in the post-COVID world now? Dr. Affan, you're...
Sorry. Yes, thank you for the question. It's really very difficult. It's almost impossible. That's just remember now a couple of days ago, as we are migrating our data in our practice from papers, we thought we are completely paperless because we have been adopting electronic medical records for a long time now. We found out that over the last year, our practice has used around 600,000 fax papers to just do some referrals or send information about our patients to some specialties and some hospitals. So this is completely, when you get into the financial part of this and the time consumption for this referral and the inefficiency, I think this is really very tough. Nowadays, I hate that healthcare is lagging behind other industries, that we are still in papers or have faxes, where in banking systems, other systems, they already adopted some more kind of elegant ways of doing those or getting rid of paperwork. And I'm very banking on people like Dr. Hanekom and Pradeep and all people who are working on the blockchain side to give us those solutions as soon as we can. Then our practices will be more efficient, not only in the United States, but worldwide as well.
Interesting. The next question we have is for Mike. Do you see, a lot more depression lately? And to that end, how can we, try to help people that are, really troubled, in this post-COVID world?
Yeah, thanks for the question. It's very appropriate. I mean, the short answer is yes. However, I mean, what can we do? It's interesting. The same survey I referenced earlier, with 1,000 men surveyed over the age of 18, 66% of them said they rarely talk about COVID to anybody or their mental health. So that's a big number. So that's obviously around communication, right? And kind of opening up and being transparent yourself, and being willing to talk to, whether it's a partner, a spouse, a family member, a psychiatrist, someone else in behavioral health, anyone, about how you're struggling. And I have to tell you, like, our system's been very strong in this area. I mean, myself personally, the hundreds of caregivers here in Canada, in April through June, I actually reached out to them and did 15-minute Zoom calls, our team, to see how they're doing. Because as you probably, everyone on this call is familiar with, I mean, there's a lot of individuals, all age brackets. For example, for us, caregivers that are in their 20s and 30s, that are younger, that are in a condominium that are 30 floors up, and they don't want to ride the elevator down, and they're nervous, right? So I think giving people the opportunity and encouraging them to open up without consequence is really, really important. I fundamentally believe personally there's no such thing as over communication. So my suggestion and recommendation is we have 2 ears and a mouth for a reason. So spend a lot of time listening to not just patients, of course, right, but also fellow caregivers.
Thank you, Mike. Really interesting. Swapna, COVID, the vaccines are coming, and there's been a little bit of a battle about who will get it first and, who's going to pay for it and all that. I remember, at least my parents telling me about the smallpox vaccine, and scientists really got together. They worked very hard to make sure that everybody around the world could be vaccinated from smallpox, so that we could eradicate that very terrible infection. So how can we do the same for COVID?
Now, that is actually a very interesting question. I mean, as you know, that there is a race across the world right now. I mean, several companies going into sort of like the second or the third kind of clinical trials. But I feel that this has to be, weighed in with risks and benefits. And we really need to look at more data and more studies to make sure that whatever has been kind of like discovered so far is actually a safe and an efficacious way to, distribute and disseminate the vaccines. I am hopeful because reading some of the Moderna trials, as well as Kaiser is actually involved in other trials, that there will be some solution to this. But realistically, I do think that there needs to be a cautious approach to it, and to weigh in to make sure that these vaccines are indeed, kind of like studied well as they had to. And as you say, with smallpox, it took a while for smallpox to be eradicated also. I mean, I don't remember because I'm actually from India as well. And I think that unfortunately, I feel COVID is here for a while to stay. That is the new reality. That is the new normal. So the telehealth and adoption of these new technologies are something that I feel is going to just stay. Again, as I said, I'm very hopeful that the vaccines development and can occur soon.
David, how about continuing on that thought? How can we make sure that this vaccine can be made available around the world? Who pays for it and how? And you're on mute.
That's a very relevant question and has major geopolitical consequences. We're already seeing playing out in the world the haves and the have-nots, and how the power from the various political leaders and interest groups, I think. And I think there are some basic things that we need to remember. One is COVID impacts any human being, and maybe once, maybe multiple times. The consequences can be severe, including loss of life. That has a significant impact. There is going to have to be the ability for the average citizen to trust the vaccine supply, the manufacturer, distributor, the prescriber, and the payer. I view the vaccine race as a need for the entire world to pull together to manage this as a collective threat. Unfortunately, I'm not seeing much of that. It's very clear that our institutions, be they governments, NGOs, World Health Organization, and multiple other bodies, are struggling to understand and to coordinate these activities. And so, to Pradeep's point, if the authorities in place currently don't arrange for a priority-based, equitable, affordable distribution of vaccines to those who need it most, and think about the global population, I think you will see unrest. I think that the average global citizen will demand from their leadership access to, and the thought for me is, how do you balance the need of the population in terms of a safe, effective vaccine that is delivered in a transparent way? You can track the utilization of all the various candidates. You can document the side effects securely while sharing to the necessary people so that we can find the best vaccine. And then secondly, the commercial aspects of this in terms of allowing the free market to generate a profit to sustain these various activities. I'll say lastly that we have to find a balance between those things. In my opinion, this is my opinion only, if the federal government has funded in the United States the majority and have provided billions of dollars of loans to the companies, the pharma companies, to produce this weapon in our arsenal to protect its society, then there is a need for that to make sure that it's distributed appropriately. And that also means that the richer countries, or those that have power, geopolitical power, need to do the right thing, which is make this available to those countries that may not have the financial means to do this. Because it doesn't matter how successful you are in immunizing and reducing the spread of COVID in your territory, your region, your city, or your country. If you don't deal with this as a global issue, you will just have the disease and the infection rate move from one area to another area, and this will continue to infect across the world. And it's just not practical or necessary to shut down all travel across the world because of the devastating consequences that's having on our economic well-being and the ability for the average person to feed themselves, their family, provide protection, housing, and education, all the things. So big question. This is going to be the test of leadership and our humanity across a global community, and it started 7 months ago. And I'm hopeful that we will get greater cooperation and greater compassion very soon from our leadership across the world to achieve those goals.
Thank you, David. And our last question, Pradeep. Individuals still want to know that their records are protected, that their information is protected. As you know, blockchain can be public where everybody can see it. But how can we make sure that this information is protected? Nobody owns the blockchain, right? So how can we, as individuals, make sure it's protected?
So there are multiple ways to implement a distributed ledger, and the objective here is to define the perimeters of the ledger. Who is participating in the ledger? Who can publish? Who can read? What are the rights of participation on the ledger? And what can you put on it? And how can you grant access to what you've written to the ledger and what you want somebody else to be able to read? So with those basic parameters needs to be configurable in the context of healthcare. We call this distributed ledger configuration a care network. So a care network in our world can be configured to meet the specific information sharing and information control needs of every participant individually. Every participant has a role, and each role has certain constraints, both in terms of reading and writing to the ledger. But that ledger is not singularly owned by one person or one company, including Solve.Care or you or any other organization. And that allows for this ledger to be certifiably intact, meaning it's immutable, or in simple terms, it was not tampered with by anyone. No one can go in and do a mass update on a database record or delete someone's record or get rid of someone's access, because that's not permissible in the technology. So the value proposition of a distributed ledger, properly configured, is to give those who are publishing their content on that ledger, say a patient or a doctor, to have full control over who can read that ledger, and not only to give control, but to take it back. And that allows for patient privacy, patient sovereignty, as well as the ability to directly interact between patient and doctor. So in many ways, a blockchain is not a replacement for electronic medical records, but it's rather a control mechanism through which records can be properly shared, and consents and permissions can be granted and taken away. And every event is permanently recorded so that there can be no dispute later on who gave what consent to whom to see what record, and did they see it or did they not see it. It becomes the ultimate vehicle of auditability through which we can then enforce proper delivery of care, proper delivery of benefits, and proper delivery of payments. So that's the general, it's a very complex but a very appropriate use case of blockchain. Now, in the context of how does a patient specifically control their data? It boils down to the patient essentially has their own node or vault on the chain, and that node or vault is what they are giving others access to. So if I want to see Dr. Swapna, because I'm planning to have a consultation with her next week, I can give her consent on the chain to access my vault which she has the ability to read, but not necessarily to share with anyone else. But if she needs my permission to delegate consent, I could give her a delegated consent, which allows her to share that with Mike, and so on. But the ability for me to take away that consent is as powerful as giving it. So those are the ways we can improve the patient privacy and patient security while giving a much more effective vehicle for everybody to collaborate. If I may also want to go back to just one comment about what Dr. Hanekom said, I absolutely agree about the vaccination. This is a challenge for humanity as a whole. And I think a distributed ledger applied to that, both in the context of need determination as well as efficacy of vaccination, not to mention the traceability of which vaccine was delivered where, and where it was manufactured, where it was distributed, where it was consumed, when it was manufactured, when it was consumed, is a very important part of gaining trust in the vaccine. We are going to have as big a problem as we're going to have in terms of the economics of the vaccine, we're going to have an equally important problem to solve, which would be in the context of how do we get people to believe in the vaccine. And we also know that there's a probability that the vaccine will not be a single instance vaccine, that we might see immunity rise and fall with time, in which case we may have to go back and do repeated vaccinations. So that will lead to a very unusual and unfamiliar model for most people on the planet who used to vaccine being a single instance, or at least a very defined instance. And now we're going to have to deal with the fact that, well, you got vaccinated 6 months ago, but you know what? Based on latest data coming in from other patients, we probably need to revaccinate you again. So there's a lot of things here that vaccination, there are so many challenges around properly vaccinating humanity against COVID. And I think a distributed ledger applied in the context of proper transparency while maintaining patient privacy is absolutely going to be a defining and a very empowering thing. There has to be political will, there has to be a clinical background for doing all of what I'm saying. But at the end of the day, I'm absolutely convinced that blockchain has a very big role to play in making sure that the right people get the right vaccine at the right time, as many times as needed, in a manner that allows us to protect ourselves in the global economy.
Thank you, Pradeep. Well, it's been a fantastic show. Thank you, everyone, for joining us. And we hope to see you again soon. So thank you very much, and see you around. I'm Jefferson Nunn, your host.
Thank you, everyone.